We are extremely excited about being able to come to wonderful Birmingham and talk to you guys about what we actually do in the state of Mississippi. As Lisa has stated, we're the Center for Independent Living. We are pretty unique as that we serve the whole state of Mississippi. And we provide services that are pretty unique to us. They are services that we feel that we are the experts at, such as peer support and information and referral, things that we would know just living our own lives. Life was actually established in 1993, and the reason that centers were actually established is because there were a lot of people that were making decisions for persons with disabilities and not taking in mind that that person had a say-so about their own life and their own rights. So the actually centers were created so that they could be consumer driven, so that anyone that has a desire to be able to live in their own home, to live in their own community, they would have a group of people that they could actually come to for information, and we would be able to assist them and lead them in the right direction to be able to live their own lives. Anyone that's here, you would, if you had an accident or something happened, you would still want to be able to work and live in your own community just as you are right now. And that's what we're all about. In a nutshell, we just make sure that anyone that's living in an institution or anyone that is in a possibility of fear of going to an institution, a child, that we provide the services, we let you know about your rights, we let you know anything that you would need to be able to stay in your own home and community. I'm going to let each one of these guys introduce themselves individually, and then we will they will tell you exactly what they do and how they provide that service. And how, of course, how they got started with working with our agency. And then we'll have someone come to you and talk to you about people first language, the importance of making sure that you are speaking correctly. You know, we all say that words have meanings, but when you're speaking with someone or you're talking with someone, the last thing you want to do is to shut that person completely off because you're using this complete incorrect or antiquated terms that has absolutely nothing to do with their lives.
I've been working for Life in some capacity since 2012. I started off with our AmeriCorps program, which was designed to transition individuals from nursing homes back into their own homes. I was injured in 2008 playing football in high school. I got hurt my senior year. I was making a routine tackle and broke my back and injured my spinal cord. Outside of Life, I'm an accounting major at Jackson State University, and I play wheelchair basketball.
I am actually an independent living specialist at Life of Mississippi. I work under the grant Healthy Opportunities for Transition, and we provide services for young adults between the ages of birth and 21 to make sure that they get the support services that they need and make sure that we're guiding families in the right direction to receive services. You know, outside of work, I have a family. You know, I'm getting ready to go back to school in August, so I'm going to continue my education also. I acquired my disability in 2002, gunshot injury. I was actually shot in the face. Some guys tried to rob us before our vehicle, and it ended up leaving me paralyzed. The injury is a C6. I'm a C6 quad. That means it's a high injury. So it left me a quad. The thing about my injury, it kind of left my whole family in shock because no one knew what to do, and no one knew who to call. You know, when you go through something so tragic, a lot of times you just not in the knowing, and we don't know. Just so happened, you know, a few people that my family members knew of Life of Mississippi. Before I even knew about them, they led us in the right direction, made sure we had the information that we needed, so that I can, you know, gain my independence back and pretty much learn what steps I needed to know from, you know, being paralyzed in a hospital bed. Actually, one of the guys up here with us came out to my hospital room several times to talk to me and try to let me know what to expect next. And I can recall turning them around over and over again because I wasn't ready to talk. A lot of times it takes time when you're going through something like that. Just so happened he was persistent. Roger down here, he ended up coming to my house. And one of the greatest things I could have learned was to try to live a normal life. You know, don't let your disability define you. You know, don't sit at home every day depressed. He told me if you was playing sports, you can still play sports. So the agency really does help people hands-on, help families hands-on with trying to figure out what's next and what community supports are available. And that's how I really encountered life in Mississippi and learned about the services. And not too long after that, I ended up joining AmeriCorps and ended up going back to school because of the AmeriCorps program in Mississippi. And before I knew it, I ended up being an employee for the agency because I learned so many community resources and learned what was available, and I was able to help other people.
I'm a T6 paraplegic. I started with life in 2004 due to a car accident, and I had fell asleep behind the wheel driving home from work. Then I got involved with life by a guy named James Clayton. He came to the hospital and he basically came trying to get me to play basketball. So then a couple of weeks later after I got out of the hospital, then I got a call saying about was I ready to go to work. I told him sure, I was ready to go to work. So that's how I got hired with AmeriCorps. In 2004, I ended up being the reception for life. And then about 2015, then I became the executive assistant for Augusta Smith.
I started working with the Life organization. It was actually a thank you because I was working in a place that I could not stand. And I was working in a Goodwill store. That wasn't my personality to work there because I was not an indoor person. And so one of their staff members came in saying me, and of course it was a female, so I started talking with that person. And she asked me if I wanted to become an AmeriCorps member. I said, yeah, I reckon. And I said, will it get me out of here? She said, yeah. I said, okay, cool, I'll do it. And so I went in and I started out, and people started getting sick. So I moved up the ladder pretty quick.
Oh, wow.
And I was very thankful for that because I got a job. And so I've been there ever since 2002. And so I'm the old dude. And I work with people from the ages of 21 until death. And so I try to do things like with Desmond, you know. I do the peer support. I try to give them the proper information, proper INR.
We at Life in Mississippi, we recognize talent. And when we would see someone coming to the agency that really had that fire, that really had that passion to make sure that they were passing on the information that they knew, they were really willing to open up their lives. I'm going to introduce someone that was the former AmeriCorps director, and she would always kind of get upset with us because she would say, as soon as I get good people, y'all steal them. And it was like, yes, but they're going to be good with us. So all these guys actually started with our AmeriCorps program. And they're doing an amazing job right now, going out peer supporting, make sure that if someone needs some information, we know for a fact, without a shadow of a doubt, if Roger Bullock goes out to peer support with someone, they're either going to be ready for life or they're going to be terrified. Because Roger is probably one of the most honest peer supporters that you're ever going to get. If you're not doing what you're supposed to do, he's going to tell you, well, I'm probably not going to come back to see you because you're going to be dead. He's just going to be very honest. If you're not doing what you're supposed to do, if you're not taking care of your body, he's going to be the person that he's not going to sugarcoat it. Desmond and Lawrence, they're going to try to be nice and tell you all, the nice way of putting it. He's probably the best, most politically incorrect person that you're ever going to speak with. That's going to be Roger Bullock. If it's someone that is not listening, Roger is going to be that last leg. If they don't get it from Roger, they're not going to get it. So with the group of them together, they can do an amazing job making sure, and you have to think about when you're talking about peer supporting, you're doing the whole family. You know, is there a wife in the situation? Is there a husband in the situation? Are there children? So we kind of match up those people with everyone that they can talk to. If you've been married 20 years and now your husband is a new wheelchair user, we can get them to speak with Roger's wife, Gail, and say, hey, this is what's going on. If there's a young guy that's in here, yes. If there's a young guy that's worried about dating and pulling girlfriends, you know, we're going to send Lawrence. You know, we're going to send Lawrence. If there's somebody that's, you know, kind of suave, you know, they kind of used to be player, but they're trying to settle down, they're trying to act like they settled down. She's not close, is she? They're trying to act like they're settling down. You know, we're going to send Dez in there. You know, Dez is a new family man. So we're going to make sure that we're matching up the right person with the right personality so that they can get the situation and get the exact information that they need.
We received numerous awards during the length of the program. But the two I'm most proud of was our AmeriCorps program in 2010 received the award from National Service Inclusion Project for recruiting the most people with disabilities to serve with the programs. And in 2010, every year, AmeriCorps recognizes one AmeriCorps member to represent all 57,000 AmeriCorps members throughout the nation. And in 2010, our program, our member Dwight Owens received that award. And he received his award at Radio City Music Hall in New York City. And it was just an amazing time for everyone. And especially, those awards are important, but the one thing that I am most proud of is the fact that during the tenure of our program, we transitioned 185 people from nursing facilities into their own homes in the community. And not one person moved back into the community, into the nursing facility. They're all living in their own homes in the community. Now, to tell you something about myself, I have 3 children. My middle child, Gary, has a hidden disability. And we ran the gamut from frustration at homework time, school time, everything, because nobody could tell me what the problem was. He scored the highest in his school on the math, but everything else were F's everywhere, all over the place. And physicians, nobody could tell me what's going on with Gary. And finally one day I was reading a book, and Gary always said, spaghetti. Not spaghetti, but spaghetti. And I was just reading the book, and the word spaghetti popped out at me out of that book, and I thought, that's it. That's it, that's what's going on. And so we went back to the physician, and he was diagnosed because I was the mom among many mothers who refused to give up and say, you know, just place him in special education placement and just leave him there. And they figured out what was going on and the accommodations that he needed to learn in school. And now Gary is out in the world living his own life. I tell everyone I have a son who's a minister, then I have another one that's on the total end of the spectrum, but he's living his life. I am really proud of these guys here for serving with the AmeriCorps program, because without them, AmeriCorps would not have been the program that it was, a successful program. But now to talk to you briefly about People First Language. There are a number of words that I want you to exclude from your dictionary, from your memory. A number of them, but 2. Can you guess the 2 most important ones? Mental retardation and what? Handicap. If you can take 2 words out of your dictionary, mental retardation and handicap, we are not handicapped. And Augusta has an amazing story about how that term even came into play.
During the time when persons with disabilities were not allowed to be able to maintain gainful employment, most people would actually sit on the street and actually beg for monies to be able to live. When most people would actually sit on the streets begging for money with their caps in their hands. So they got termed the handicapped people because they would have their caps in their hands. So that's why we feel that that's a completely derogatory term, because we're not begging for anything. We're out, we're living our lives, and we're working. So when you think about someone, when you say that terminology, someone is handicapped, you're not talking about anyone that's living their lives that is so antiquated that we just don't, that's just a term that's just completely just wiped out of our life. So we just don't use that word, and that's where it came from. People actually sitting on the streets begging with their caps in their hands.
This is just a brief overview of some of the words or some of the terms that we hear often that does not apply to anyone here or anyone with a disability. We're not wheelchair bound. We're not wheelchair bound. And we had an incident to happen at one of the local restaurants. We were in training when we visited this restaurant to order. And there were about 8 of us. And the waitress comes over, and you've heard these guys talk about, different things today. The waitress comes in and she looks at the person who doesn't have the physical disability and asks them to speak for the group. Can I take their order?
Can they read?
Can they read? What does this person want? What does this person want? And we're all sitting around the table saying, well, I would like to have this, or I want to get this. And so what do? We left. I cannot think for myself. I cannot speak. And so that's some of the training that we provide throughout the state is changing those stereotypical attitudes about people with disabilities. We all go from point A to point B. We just use different modes of transportation to get there. And so that's the training that we provide throughout the state.
We talked about the different forms of services that we provide, information and referral. Advocacy, we can actually advocate on a one-on-one, or we are fortunate enough that we can advocate actually legislatively, whatever means we need to do. We're actually very fortunate that we can advocate on all levels. We provide a lot of services in the school. Dad's talked about 0 to 21. If you think about all the issues that a child would need when we're talking about transition, not just nursing home transitioning, but if you're transitioning from junior high to high school, that's a big transition just for any student. But if you're a student that has a disability, that's going to be a big thing for you. If you're a wheelchair user, it might be a big deal that you have a top locker. Just anything that we can kind of walk you through. Parents being able to make sure that they know their children's rights. Information referral, these guys know just about everything that's going on in the community. You ask them, they can if they don't know, they're going to find out, they're going to pick through it. Skills training. Who am I to go out and tell somebody how to transfer from their wheelchair to their car? That person that's a wheelchair user is going to look at me like, what? Who better to tell them than somebody that's actually doing it every day? That's what we mean about people doing things and showing them exactly. We believe that there should be nothing about us without us. We are actually, about 85 to 90% of our board members are persons with disabilities, and about 80 to 85% of our staff are persons with disabilities, or they have a family member with a disability. I'm in the same situation as Margie, as I have a son that has a disability. So we've actually fought that system. So we know what it's like to not be respected and be able to have to fight your way through.
We know that if they need services, they just acquired an injury and they're not doing anything that's available. Once they get up to health and they're able to get out, we always try to get them to come back to our center. We have a health and wellness program there where they can learn about healthy opportunities, healthy eating. We want them to come to the training so that they can be advocates the same way we had to learn. Because at first we didn't know. And it took for us to come to a group meeting or come to a training to say that, you know what, this is something that I want to do. I didn't know that I wanted to go out and speak to people about being, having a disability or a spinal cord injury. It's just something that once I came to a meeting and I met other people, and I was like, you know what, I think that I can do this. I can go out and talk to youth groups, I can go out and talk to other professionals. So once they come to the center and they get some training and they come to some of our peer support groups, they're going to see it within themselves. That, you know what, I want to go out and talk to people also. Or we'll test them and be like, do you mind maybe providing peer support to someone else? Because there's so many people that acquire injuries every day.
You have to go in and get into a conversation with that person so that you're actually analyzing that person during that conversation, and then you have to pick that soft point. Once you find that soft point, then you can start easing in your information into that. And you have to ask about their lifestyle before they acquired the injury, and then the lifestyle you think they may have after they leave. And then you have to go in there and fill in as much information as you can with that person.
We also provide those trainings to companies in the community, to just regular people not just on people first language, but also on ADA. We've trained the Jackson Police Department. We've done trainings with the nurses that are going to be working the shelters. So we've trained a variety of people, and pretty much anybody can benefit from some of our trainings.
If we don't have someone on staff who can kind of track somebody down, that can assist that person if they're walking through, breast cancer survivor or HIV or whatever it might be, we could actually pair that person up with somebody that we might know that's kind of moving on and moving forward with their life. And of course, we get permission from them to talk to them about what's going on, and then we can kind of pair them up. Parents, we've actually had situations where a mother has just given birth to a child that might have a disability. So we can actually pair that person up with another mother on what they can expect from that child, or what they can expect. The doctor's coming at it from a completely medical situation. So we want to make sure that they understand. We have situations where we do sibling support. Because if you think about it, most of the time if a family has a child with a pretty significant disability, who's getting most of the attention? The child with a disability. So we can kind of pair that person up with another sibling on how they got through it. So we kind of go from the whole gambit of life experiences on what a family would need to be able to live. And one of the things that Margie says all the time, that we are the fastest growing minority, and we accept anyone at any given time. I don't think there's enough preparedness on anyone being prepared for disaster. That's just anyone, especially if, when you start talking about people that have disabilities, because there's certain things that you have to have, and people just aren't preparing. I know that when we were actually assisting after Hurricane Katrina, people were just completely caught completely off guard. One of the things that we were completely upset about with that is, if you had a disability, you went to the medical shelter. You could be completely capable of caring for yourself, taking care of yourself. Nope, you have a disability, so you need to go to the medical needs shelter. That's it, no ifs, and buts. Well, you might want to be with your family member. Your families might be at another shelter, but nope, you have to go. So those are the kind of things that I think that those questions are actually coming up now. That people are actually talking about access to functional needs and what that person will need. And they might just be able to, survive in just a regular shelter. But those are the kind of things that we want to make sure that we're working with you guys about, to make sure that people kind of can understand.